Obviously, I've been living in Asia a long time. I'm training, I'm fighting, I'm constantly getting injured. One of the problems in Asia is that they don't have very good sports medicine. Even in China, surprisingly, the first thing they want to do is do an operation. So definitely, I don't like to use the word holistic medicine. Most people know the Brooklyn Monk. I'm pretty much against any kind of new age crystals, vegan, anything like that. However, I like the word holistic in sports medicine because it's the idea that it's not just treating the injury that you have right now, but adjusting your lifestyle, adjusting your diet, right? The training, the exercise, the stretching. Maybe if I'd been doing yoga straight along, I wouldn't have had these problems. Or if I'd been doing, one of the physios, European physios who looked at me told me had I been doing more hamstring exercises with weights, maybe I wouldn't have, had the injury in the first place. So I like this holistic approach you have. You're doing martial arts, you're doing fitness, and then you're doing the medical as well.
Yeah. And I think, look, we had a seminar this morning. We talked about diet and exercise and the role of that. And I really like, it's not just natural and consistent with my ideas. Because as a martial artist my whole life, I've liked to use lifestyle modification rather than drugs as my first choice. But what's tremendous about this PRP and stem cells is not only is it consistent with my philosophy, but also the scientific data that we've got is way ahead of the scientific data for a lot of conventional medicine. And for example, for a knee with a meniscal tear, the long-term data on a lot of clean-up arthroscopes is that on average 2 years after the surgery, people who had the surgery or had a placebo operation are at around about the same point. And what we find is that some people get better with a clean-up scope, but some people get worse. Whereas with our treatment, 78% of our patients do get better, but the 22% that don't get better, they don't get worse. Right, and they can still go and have the operation.
Well, this is the thing, all right? So I'm not a medical specialist, and neither are our viewers, but I'll say, just as a layman, with a little bit of education, as an educated layman, let me say that the way I looked at it was this. With the operation, they were telling me if I had the operation done in China, 70–80% likely I would never wrestle again. I've been told that there were people in Australia or the States who can do the operation where it was 70 or 80% likely I would wrestle again, but it's very expensive, very expensive. In Beijing, it was going to cost me 30,000 RMB, which is like 5,000 US dollars. In America, it would be, of course, a multiple of that. The thing is that, and I don't want you to feel like, I looked at you as a gamble, but if we play the percentages, I'm letting or I'm not going to say I'm letting, I'm grateful that you're treating me, but God forbid if it doesn't work or I don't see improvement, I still have the option of getting surgery.
Yeah.
And even if you're going to get the surgery, it's still better to have any kind of surgery where they don't take out your original parts and put in plastic, which is what they wanted to do in China. I'm like, you can only do that once.
Yes.
And there's nothing else you can do after that.
Yeah, and I think one of the things that we're working on, particularly with these degenerate knees, osteoarthritis and meniscal degeneration, is we're trying to preserve as much of that meniscus as possible. Because when you start cutting it away and tightening it up, you end up with less of that protective meniscus to separate the two bony surfaces, which ultimately is heading faster towards osteoarthritis. And a lot of our athletes are prematurely getting osteoarthritis. We live in a world now where we're all living longer. When I went through medical school, life expectancy was 72, at least 83.
He's been to medical school.
Yeah, although, as you were saying before, you described yourself as a layperson, but you've done your research, and with the research you've done, you're probably more informed about issues such as regenerative medicine, PRP and stem cells than the average GP or doctor, and actually more informed than a lot of the older orthopedic surgeons who still don't really know because they haven't really done the research on this. But there's a lot of information out there that's accessible on the net. And we should, I don't for a second believe that just because someone doesn't have a medical degree that they know less about a particular subject than a doctor does.
So, Dr. Lewis, you have worked on some MMA fighters, some wrestlers.
Yeah. Particularly James McSweeney, who's done a cool interview for us after we treated his knee. He tore his ACL in a cage fight, cage rules, and I saw him a few days later. He had a knee full of blood. We drained the blood. We injected PRP. We did this a couple of times. Of course, he taught a seminar, kicked on the same knee, came back to see me, swelled up with blood again, PRP'd him again 2 more times, And then 3 weeks after his original injury, he fought and won another cage rules event.
And it was actually torn?
Yeah, it's completely ruptured ACL.
Completely ruptured. 3 weeks later, he fought and won.
Yeah.
That's insane.
And of course, I'm not saying we've given him back a new ACL. This is totally not the case. But when an ACL is ruptured, the major reason why your life's really bad for a while. Your knee is swollen to the max, and you're in a lot of pain. Now, the pain is partly due to bone bruising. Now, we believe that when we put the PRP into the joint, we reduce the bone bruising tremendously. So the pain factor is massively diminished. And then by removing the blood and putting PRP in, we not only take the hemarthrosis out, which is very painful, but the platelets which we put in stop further bleeding. So the resolution of that swelling is much faster. I've even experimented, if you like, on myself, where I've had broken ribs. I've had a lot of broken ribs because I'm stupid enough to fight people bigger than myself. And normally, you know, broken ribs, 3 days pain, 3 weeks, can't do anything, 3 months before you're back to normal functioning. Well, I had PRP injected the following morning onto the broken ribs, and I was sleeping comfortably from there on, and I was able to continue my normal work. I wasn't completely healed, but life was back to normal very much faster.
Right. Yeah, and the big thing with the knees and that, and you know, you're a doctor, obviously you'll correct me if I'm wrong, but the big thing with the knee, like, for example, I had a bad knee and a good knee, and I was functioning. Now my good knee is my bad knee. Suddenly the other knee is giving me problems because why? You know, it's taking up the slack, taking up the weight. Yeah. And so I think, you know, your body's a system. It's called a system for a reason. A system means all the parts have to be functioning, right? Yeah. So, you know, we have an injury in one place, we got to fix that, or else it's going to cause injuries elsewhere. So, right?
That's true.
All right. Well, we've been here in Pattaya talking to Dr. Peter Lewis. Oh, and if you want to know why he's got this crazy British accent.
Born in England.
Yeah. Oh, were you?
Yeah.
I didn't know that. I was lampooning myself, not your accent.
No, I grew up in Australia, born in England.
Okay, so he's born in England, grew up in Australia. But anyway, so he has a permanent clinic there in Melbourne, right? And a martial arts school there in Melbourne, and we're probably going to shoot Martial Arts Odyssey there someday. In the meantime, the reason he's here in Pattaya, there's a clinic here in Pattaya when he's visiting, I guess once a month and seeing patients, right? About every 28 days, coming here to see patients. So for most of my friends, Thailand's a lot more accessible, you know, than Australia. So this would be a place where you could visit Dr. Lewis. And Dr. Lewis, could you go ahead and tell them the name of the clinic? And,
sure. We're the Surecell group. And
Surecell.
Surecell. What I'm doing here is training the Thai doctors. So we've now got some really good doctors here. So you don't have to come while I'm here. We have an orthopedic surgeon who visits our clinic every week, and he can do all the difficult orthopedic stuff. And we're now the leading PRP stem cell center in this part of the world. It's good.
And when you get this PRP treatment, they take some of your own blood, right? Spin it in a centrifuge. So this is what I'm going to do. Make special offer. Anybody who wants to mail order some of my blood, you can own blood from the Brooklyn Monk. It'll be stored at Surecell Center, and you can just write to Dr. Peter. He'll sell you some of my blood. How's that?
Yeah, we're gonna have to get you tested first.
You know what? Maybe we should have this discussion before I turn on the camera. Hey, you know what? I got to touch on one just quick sensitive subject, and I don't want you to feel like I'm Shanghaiing you. I'm just going to touch on this very briefly. A lot of you know I grew up in Tennessee for a lot of my life, rather than Brooklyn for you know, part of my life. And a lot of people there are very religious, and there's been a lot of debate about stem cells and this and that. But what I want to say is, what's the big word you used?
Autologous.
Thank you. Autologous. This is taking your own blood, or in some cases taking your own fat.
That's right. We get stem cells from fat.
Right. So there should be no ethical issue here. This is taking something from your body, putting it back in. Okay. So it was a very nice. A couple of my friends from Tennessee wrote in the other night, and they were telling me that they're very religious and stuff, but they're in favor of this treatment because it is autologous. Although none of us knew that word until I met you. All right, so I'm the Brooklyn Monk. We're in Pattaya with Dr. Lewis. He's making me strong again. So hopefully I'm going to be fighting again. If I fight and win, everybody's got to come here and have this treatment, all right?
Great.
Okay, thank you, Dr. Lewis.
Good on you.